And if we allow our vaccination rates to slip, they might start dying again.
New overnight, health officials confirm measles cases in the Edmonton area. So good morning to you at 8 o'clock here on Monday morning. We are tracking new measles cases, which have been confirmed in our city and in other parts of the province. Our Nicole Lampa has more on this story as it develops this morning. So Nicole, as we wait to find out exact numbers of cases now in Alberta, any indication why this is happening?
Well, Kent, we spoke with an infectious disease expert who says that vaccine hesitancy is playing a role, but a small one when it comes to the rise of measles cases across our province and in the country.
Some of it is probably lack of access to medical care. A lot of people missed appointments during COVID. A lot of people don't have access to a family doctor. A lot of people just can't access the healthcare system.
Alberta Health Services says anyone who was at the Bell Reeve MediCenter's family health care clinic last Wednesday afternoon, March 12th, as well as anyone who was at the Stollery Children's Hospital on Friday and Saturday may have been exposed. Measles symptoms include fever of over 38 degrees, cough, runny nose, red eyes, and a red blotchy rash that appears 3 to 7 days after the fever starts. That rash begins behind the ears and on the face and spreads down to the rest of the body. If symptoms develop, you should stay home and call HealthLink before visiting a healthcare provider. For most people, measles is a mild illness. However, some may get seriously ill and it can be deadly.
If you come into contact with somebody who's infected with measles, there's a very high likelihood you're going to get sick because measles is one of the most infectious diseases out there. We often say that one case can infect 9 other people, and that's a lot.
The infectious disease expert we just heard from says that if the virus spreads to the lungs, then a patient can develop pneumonia. And in more severe cases, if it spreads to the central nervous system, that's when it can cause brain damage and can be potentially dangerous. As for the cases here in Alberta, as of last Thursday, the province said that they were aware of 6 measles cases that was linked to an outbreak in the Little Red River Cree Nation. However, since then, there have been more cases reported in Fort Vermilion, in the Calgary area, and now Edmonton. Kent.